2017 probably, I noticed just urination problems. I was diagnosed with PPH. I did a flight physical every 2 years. My blood work came back and we discovered that my PSA had gone from normal to really high. And it was a concern for my DO. So he recommended that I see a urologist. He ordered a biopsy, and then in June of 2018 we discovered that I got the diagnosis that I had prostate cancer. We saw a radiation oncologist and a surgeon at a major medical center in Arlington, Texas. They both used the National Comprehensive Cancer Network guidelines for my particular form of cancer to recommend a protocol. So the radiation oncologist obviously predictably would recommend radiation, and the surgeon would predictably recommend surgery. I'm not a doctor. I've never dealt with cancer. I've seen people die from cancer, so I wanted to do my own research. I wanted to find out, get information that was not just one-sided. I discovered the first important thing was, is any of this stuff going to work for me? And is it working for others? And what I found out was that there's not a whole lot of difference between mortality today than there was in 1959. You make a decision on life and death at that point. There is a certain fear factor, and because of my faith and because of I'm a pragmatist by nature, I didn't really have a lot of fear. I was on a mission to discover what was going on in my body. So I continued my research. Envita kept popping up. I narrowed down the list, and I filled out patient information forms for 3. 2 of them called me back. 1 of them was Envita. I first talked with our patient coordinator on the telephone, Ashley, and we had a long talk. She wanted to know more about me. Actually, she wasn't trying to sell Envita. After that talk, I remember going home and telling my wife that we're flying to Arizona to interview Envita and to consult with the doctors there. We met Dr. Ertley, we met Dr. Sears. They were the same way. We met Ashley, and they were the same way. They cared more about me. They wanted to hear my story. And one of the things that interested me initially was Envita does a lot of testing. They want to know about my current condition. They run all kinds of gene targeting type tests. They want to know my mutation load. They find out the circulating tumor cells. They run tests on toxic compounds and chemical loads and heavy metals and all this stuff. It's not just about cancer, it's about my metabolism and my overall health. It's not just me, it's the other patients too. I've seen people here that were in wheelchairs 2 months ago and they're up walking around. I met a man that had throat cancer, and when I first met him, he could barely stand up, sit down. His mobility was affected. He couldn't hardly speak. He came here about the same time I did. And he left a couple of weeks ago, and he seemed normal, happy. He was talking normally. He wasn't having any joint pain. There was a result that I saw in him and in others. He's not the only one. I could list 5 or 6 people that I met here that are seeing results. And so the blood work is scientific proof, if you will, that what they do here works. They believe like I do. They're open-minded about people's chronic illness and ways in which they can help them become healed. And they don't talk about a 3-year mortality rate or a 5-year. I've never even heard them discuss that. We're here for the long haul. I want to come back here in 20 years, 25 years, and say hi to the folks here. I would do the same thing if I had to do it all over again, and I would end up here again.